Hi, my name is Mark Henderson. I've written a paper on medical marijuana, the standardization and legalization. This topic I chose because it is a very hot debate between federal government, state government, and the medical community. Reason being is because marijuana contains a drug or a component called THC, and it is difficult to regulate that medication in the drug because there are so many different strains that they just can't make one strain always and have the same amount in it. Medical marijuana, the main component is THC. It is difficult to regulate that. That's why it is a class one narcotic. It is classed that way because it is believed not to have any medical use per the federal government. Now, the medical community and some states would like to have that taken off of that list so that it can more research can be done on this for cancer patients, Parkinson's patients, epileptics, many other diseases, anxiety. All of these, all of these patients can be treated with medical marijuana, and it has been proven to be effective in these diseases. This is a medicine bottle. It could contain an appropriate dose of medical marijuana for, say, a cancer patient if the federal government would lighten their regulations on marijuana. But because of their regulations, the restrictions for doing research is so strict that most companies won't even do it. But imagine you have a family member with cancer that is nauseated, vomiting, couldn't eat, but could have a little bit of marijuana and eat without throwing up. But you could go down to the corner drugstore and pick up some for them, and it would have their dose on it. What research had shown that they need for their particular disease. How wonderful would it be for you to be able to purchase this marijuana with covered by insurance too, if it was regulated, that we could provide provide this for, let's say, leukemia patients. It has been proven to kill cancer cells, and it reduces dyskinesia in Parkinson's patients. And even in my research, I found a little girl with epilepsy that no other medications was helping her. And her mother found marijuana in an oil form, and they actually bred most of the THC out of it. And this little girl doesn't have seizures anymore, but it is illegal for her to purchase that. One of the biggest problems is the fact that there's so much abuse with this drug, and that I think that's why the federal government does not want to take it off of their the class one list because of the abuse. But if we could just get past that and allow researchers to really study this for our patients that really need it. I mean, for cancer patients, I think that they would probably rather take marijuana, whether it was in a eating form or even smoking it or a pill form. Uh, I think has less side effects than a lot of the medication that they currently take for pain and nausea. Plants have been used for medications for hundreds of years, just almost since man has been civilized. We've used plants. A lot of the pharmaceuticals nowadays are made from plants found in the jungles and rainforests. And I think that we're on the right track because 21 states have legalized this marijuana for medical use. Two states have actually legalized it for recreational use, which I think has gone a little bit too far. I think we should stick with the medical use of that. But I think we're on the right track, and more people will benefit from this medication. Thank you.